My name is Laura Kincaid. I am 69 years old. I am from Shelbyville, Tennessee. I grew up there, spent all my life there. Okay, I have been a patient of Dr. Cote's for 2 years. He is special because he was chosen by my daughter for us. We didn't pick him. Like I said, he was chosen. But he is special. He is very thorough. And once he gets onto something, buddy, he is on it. So if there's anything wrong with you and he spots it, he's going to fix it. He's that kind of doctor. My journey with this started with Dr. Cote not liking the way I was breathing. He just said that he could not see how I could breathe. I said, I am breathing just fine. I do not have a problem. He said, yes, you do. You're not breathing good. So he kept sending me for CT scans. And finally, he sent me to, this was a period of months he was doing this, but after that, he sent me to a lady, she happened to be at Centennial in Nashville, to do a CT scan. And as soon as that scan was done, because he had already picked up on the fact he thought I had cancer, lung cancer. Once she did this scan, I went immediately to the surgeon. And they told me, he said, yes, you have a nodule in your lung that is cancer, and we need to get it out. So we did. Scheduled the surgery. Everything went fairly good. It turned out to be a stage 1A, which is very, very early. Recovery, well, my situation was a little different. I am a previous cancer survivor. 38 years ago, I was diagnosed with cancer, and thank God I came through it. But because of that, I had 2 rounds of chemo, and the scar tissue from that in my right lung, which is where this nodule was, made my lung be glued to my insides, my heart, lungs, liver, everything, it was glued. So the surgery required bigger incisions, more manipulation, and that kind of thing. So it was a 3-hour surgery instead of a 1-hour surgery, but it saved my life. That's the most important thing. Anybody that is a former smoker, that has had chemotherapy, had any kind of lung problems, that kind of thing, they are a good candidate for this procedure. Anybody that's had the chemotherapy or the radiation, they would much rather go through a surgery than to go through that again. It is awful. Their doctor needs to be on top of their breathing, their history, that kind of thing to, make it happen. The 2 ladies I went to, the surgeon and this lady, he had just had a meeting with them maybe a month before, and they were pushing this test, which seems kind of ironic, but he was friends with them. And they presented this to him, so I happened to be the candidate that walked in first and got sent to this thing. I'm sure once it came out, once she took it out, that it was sent to a lab somewhere, and maybe that's when it was determined what stage. I had already explained to them when they told me what was going on. I said, if I've got to go through any kind of treatment plan, I would prefer to have my old oncologist. And they said, oh no, you don't understand. You're not gonna have any kind of treatment. We've got it so early, we just gotta watch you and make sure that it don't pop up somewhere else. So that's all I had to do. And that's amazing. After I got the results of the Notify lung test, and that the results were a stage 1A, and that I wasn't gonna have any treatment, I was elated. I was so calm. My husband asked me, he said, aren't you nervous? Aren't you concerned? I said, no, you don't understand. The magic words, no treatment. That was the key. As a previous cancer survivor, I would encourage all doctors with patients that have any kind of a lung history, breathing, tumors, anything like that, to have them go through this test. It is amazing, and you will be rewarded triple-fold from the patient for doing this for them. He is a very great doctor. I would recommend him for anybody